With us here in the studio is Dr. Saif Al-Abri, who is the Director General of Disease Surveillance and Control. Dr. Al-Abri, a very good evening to you and welcome to our studio here. We would like you to brief us, or to brief the audience on the situation of coronavirus here in the Sultanate of Oman.
So far, we don't have any single case of the 2019 novel coronavirus that has been diagnosed recently in the Republic of China. Yes. However, the coronavirus as a coronavirus is very well known, and it's part of the viruses that causes respiratory illnesses. This is a novel coronavirus because it can be severe and it can spread from human to human. This is the third one of the novel coronaviruses. So we had the first one, which is the SARS, severe acute respiratory syndrome, followed by the MERS coronavirus, which is the Middle East respiratory viral syndrome, which we had cases in the past from the MERS coronavirus. And this is the third one, which is the other third novel coronavirus. But there are no cases whether in Oman or in the GCC countries, and in fact there are no cases within the Middle East.
Right. Now, if you can tell us, what is exactly coronavirus? How do you define, and what are the signs and symptoms of the coronavirus?
Coronaviruses can cause respiratory illnesses, whether it's like, it can start from mild flu and coryza up to severe lung infections that can cause death. Like people can go into the intensive care unit and die. So for the novel coronavirus, most of the symptoms are of the lower respiratory tract infections, which is mainly comes as fever, cough, and shortness of breath, difficulty in breathing, and then it can progress into severe respiratory illness or respiratory failure.
Now, if someone is suspected to have coronavirus, what that individual has got to do? What measures he needs to take?
Sure. I mean, right now, all the cases, coronavirus is diagnosed now in almost 15 countries, including China, and all the cases diagnosed outside China originally were from Wuhan province in China. They have visited there somehow. So most of the transmission is human to human transmission, or we don't know yet from where, but maybe animal to human, and then it's sustained human to human transmission. So if someone has visited an area where there is novel coronavirus, whether it's in China or maybe in a hospital where the virus has been diagnosed in another country, the most important thing is to identify himself, to say that I've been to.
Even that person, he's not having any signs and symptoms, he has to report just because he has visited that particular place? Or
at this stage where, for example, if someone has come from abroad, then he needs to identify himself to the airport authorities. We have a system now in the airport, so they need to identify themselves there that he came from China. And now we have a self-declaration form in all the flights coming into the country. So people, we advise them to declare that they have been to China in the last 2 weeks, and then they will be recognized in the airport. So if they have no symptoms at all, they will go home, but then we'll keep contacting them. If they have symptoms, then there's a procedure of how to deal with such patients. But like the main thing is recognition, infection prevention and control, and then if someone really knows that, then he can use a mask so that to protect others from from infecting them.
So these are the measures that the Ministry of Health have taken actually towards detecting these particular cases at the airports, ports, and other areas. But what are the preparation now? Other preparation the ministry has actually to deal with, for example, transferring these particular cases from one place to probably to the center?
Sure. So in the airports or in the ports in general, once we identify that someone has come from China at this stage, or maybe in the future, this is very dynamic from any other country that is labeled that it's novel coronavirus is endemic there, they will be identified, they will be followed up. If they are sick, then they will be taken. We have a clear pathway of how to deal with such people without interfering with their truffles. Okay, we have worked along with the Public Authority for Civil Aviation, with the Oman Airports Company, with the Royal Oman Police, of how to deal with them in the airports, for example. And then they may go to the community, they may go to their own houses, but we have identified, for example, if someone is sick, then he will be taken to one of our healthcare facilities.
Well, Dr. Saif Al-Abri, thank you very much for briefing us on the situation of coronavirus elsewhere, but also the situation in Oman that is clear. We hope it will remain clear, but the preparations have been done, and we wish you all the best.